Jawline, as we remember, this is the ramus, this is the vertical portion of the jawline, and then this is the body of the jawline. As you can see in Christy, we have a slight little bit of a jowling here, so this is an area that we don't want to go into. So when we're doing our measurements, just remember we're finding the gonial angle. Now if you struggle finding it, just get someone to help you, but essentially you're just going to follow the body and the ramus, and I can pinpoint Christie's gonial angle is just here. So when we're doing our marking up, you can then draw your line. Remember 120 degrees in a female, so we'll be going not as in a male as 90, so we'll have a bit of an angle. And then use your finger as a ruler. Make sure you get the bottom of your jawline and then just come across into there. And this is the portion that we don't want to inject into. This is the portion you don't want to inject into, and then we can bring it all the way across into there. In a younger patient, without any jowling, we can go straight across and just start filling. So just be mindful again of the anatomy. So we have our parotid gland that sits in this section here. And then we have our masseter muscle, which sits inferior to this area, which sits around here. That's your masseter muscle there. This section here, you've got your mandibular ligament. So that's often quite a tough area to get through. And this little line that comes down here, all of this is your mandibular septum. So you want to keep just above this area. Should you inject below this area, you'll just join the neck into the face and you won't have any jawline. So make sure you're always slightly above it. And the most important part of all of this is knowing where your facial artery is. So if you struggle or if you can't feel the notch, just ask your patient to grit their teeth and I can feel the little notch just here. So your facial artery comes through here and then that's where it makes its way up towards the rest of the face.